Since Doug Ford took office, more people than ever are getting hallway healthcare, with 2,000 patients on average being kept in unconventional spaces, like hallways. And remember, Doug Ford campaigned on ending hallway healthcare, and instead it's only gotten worse. For example, one woman who was experiencing immense amount of pain actually decided to discharge herself from the hospital because she was so uncomfortable it was making her pain worse, spending over 12 hours in the hospital, much of it in unconventional spaces. And we're now at the highest number of patients in these spaces since 2017. We can see that both under Wynne and Ford, it was pretty standard. There would be spikes, then it would go down, and then COVID happened. And things got better because people weren't at the hospital as much because we were isolating. But then things got a lot worse because of Doug Ford's systematic underfunding of the healthcare system. And Bonnie Crombie is calling it like it is. Doug Ford is doing this on purpose because he wants to starve the public system of resources to open up room for privatization. If the people can't get healthcare, they will be desperate and beg for privatization. And that has always been the goal of conservative governments in Ontario since the Michaelis days. There is one hospital, though, that's basically ended hallway healthcare. The Humber River Hospital went all in on cutting-edge technology, and it's paid dividends for them. But we can only do that at a wider scale in more hospitals with more funding, which the Ford government isn't willing to do. But it's not just that. We need more beds. We don't just need more beds. We need more nurses. We don't just need more nurses. We need more family doctors. The entire healthcare system is crumbling under Doug Ford, with 2 million people in Ontario not having a family doctor, and that number being expected to double in the next few years. And when people don't have a family doctor, they go to the hospital. 1 in 5 patients in Ontario go to the hospital because they don't have a family doctor. That's insane. We could, in theory, cut the amount of people visiting hospitals by almost 20% if we just have enough family doctors. But Ford has also been fighting paying family doctors more, so some people are retiring, and a lot of people are choosing not to practice medicine in Ontario. If we want a functioning province, if we want a functioning healthcare system, we have to pay people what they are worth. We have to pay doctors, nurses, paramedics what they are worth. We have to invest in hospitals to get cutting-edge technology, and we have to put people first. But Doug Ford doesn't put people first. He puts his billionaire buddies first.